So, as far as an exam is concerned, we should describe the instrument properly, right? So, any instrument, if it is given to you, first you should identify the instrument. Just give me a minute. So, once instrument is given to you, you identify that instrument, right? Second, describe that instrument. Describe various components of the instruments or parts of the instrument. You can go from the proximal end to distal end or distal to proximal or patient end to machine end, whatever. So it depends on different instruments. Then talk about specifications. See, this all points might not be applied to each and every of the instrument. Few points will be applied to every another, few instruments, few other points will be applied to few other instruments. Then you talk about various specifications of the instruments, like, for example, various sizes, various capacity, if at all it is available. If applicable, you talk about a mechanism of instrument. For example, spinal cord stimulator. Then you can talk about the gate theories, other theories, and the Viva can go into that direction. Next point is sterilization of the instrument. So instrument could be pre-sterilized with something, or if it is reusable, you have to sterilize this instrument with whatever is the method, right? So are you clear till this point?
Yes, sir.
Identify, describe components from one end to another, proximal to distal, distal to proximal, or whatever, or patient end to machine end. Then specifications, if applicable, mechanism, if applicable, sterilization, either pre-sterilization or if it is reusable, then methods of sterilization. Then you can talk about various advantages and disadvantages of these instruments. So advantages and disadvantages of that instrument or as comparison with other similar instruments. Like, then we'll be talking about indications. What are the various indications this instrument is used and various contraindications, relative or absolute contraindications. We'll be talking about specific precautions about these instruments, right? So, say for example, spinal cord simulator, then you can talk about the MRI compatibility, non-compatibility, and other things. And if there is any special note about this instrument, if there is something else which is specific to that instrument, then we can mention it there, right? So it's very easy. I'll just repeat once. Identify instrument, describe instrument, describe from one end to another so that it goes very easy, proximal to distal or patient end to the machine end. Specifications of that instrument, various sizes, capacities, mechanism, if at all is present, sterilization, advantages, disadvantages, indications, contraindications, specific precautions, and special notes. So we'll try and see few of the instruments. I'll try to show you few pictures. What are the things which we should be avoiding
जरा चावल और सालना क्या तुम
while describing the instrument?
नुकता चावल और भाज्या और साल
Please
थोड़ा सा
mute yourself. Okay, so I have muted all. Now, what are the things which you should be avoiding while describing the instrument? Very important thing is common instruments or most of the instruments, identification is must. Now, there is a possibility that uh, you might not know few things about few instruments. Please don't fake anything. You can tell whatever you know. Whatever the method we talk, whatever the specific points we talk, you can talk into that points. Whatever you know, you just tell it. If you don't know anything, don't fake it. It is always an saying in an examination that mistake is not a reason why you fail. But if you make some blunder, yes, it is a reason for to you fail. Right? So make a mistake, don't make any blunder. Right? Fantastic. So what is this? Anyone there?
Toy needles.
Yes, it's
To
two
we
needle.
need.
Indications, contraindications will be asked. The difference will come to that. So one of the thing where it happens is uh, if you want to pull out the catheter, then 2E needle probably is not a very good option to pull out the catheter. There is a chance that catheter can share, right? In pain, various indications like epidural or epidural adhesive lysis or caudal epidural, you can use the 2E needle. Sterilization, pre-sterilize. What is this? RX cood needle. Where it's used? Anyone? And what is the difference between the 2E needle and RX cood needle?
So it is used in the caudal neuroplasty procedures.
Okay,
The hub
fantastic.
is different
Who is
in
different?
both the needles. Hub,
See,
the
actually,
not
okay,
the hub, but the patient end. The
go on, you're correct. So there is a change at the patient end. Can you see the difference? Okay, see the difference. The difference at the tip. Okay?
Yes, sir.
Yeah. And why is that difference is because here you can manipulate the catheter, or you don't have to take out the needle and catheter whole assembly. Do you understand?
Yes, sir.
In Tuhi needle, you're not supposed to withdraw only catheter. Though some people do it, that's not the correct practice. In RX cood needle, tip is adjusted in such a way that it's cut that you can manipulate a catheter, and that's why it is used as so RX cood needle is used in intrathecal pumps, spinal cord stimulator, where they want to keep or they want to change the catheter, they have to change the direction of the catheter, withdraw the catheter. There, the RX cool needle is used. Both are epidural needles, but there is difference. Is this clear?
Yes,
Yes.
sir.
Fantastic. This is long spinal needle. The spinal needle, long spinal needle. I'll just remove this. Mm. So, what are the uses of long spinal needle? And what is the length? Any idea?
150 mm.
One.
50. No, sorry, 120 mm.
so there are 12, 120 mm and 150 mm,
So
so
yes,
which are
both.
commonly used.
Correct. Fantastic. So 12 centimeter and 15 centimeter, that is 12 millimeter, 120 millimeter or 150 centimeter, both are used. What are the various, indications of the long spinal needle?
for
So sympathetic.
transforaminal discography,
Okay.
discectomies.
Okay, so you are talking about needle in needle technique where you want to put the spinal needle first, then and then the this thing. Okay,
Sir,
anything?
in sympathetic blocks
Yeah. So
in the
deeper,
lumbar area.
fantastic. So deeper blocks like sympathetic, celiac plexus, you have to use the long spinal needle. Correct? Right?
So
Yes, sir.
And these are the pre-sterilized needles. Okay. So what is this? Radio frequency cannula or radio frequency needle? Hmm? What is specification? What is important here?
The shaft is
Correct. Go ahead.
Insulated.
yes, sir. Shaft is insulated. Tip is not insulated, non-insulated, and tip
Yeah.
has various lengths of 4 mm, 5 mm, 10 mm, 2 mm,
Fantastic. Okay. Go ahead.
and it comes with various sizes from 18 gauge, 20, 21, 22.
Fantastic. One more thing about tip.
It is now here it is curved.
Correct. So
This
it
one.
can be a straight and curve as well. Correct?
Yes.
Right? Sterilization?
pre-sterilized.
Pre-sterilize. Pre-sterilize with?
Rex.
Just go and check the pre-sterilization. Okay. Most of the instruments are pre-sterilized. Everything is written there onto the that particular instrument. So if it is an RF cannula, if it is an spinal needle, it is written there how it is pre-sterilized. Right? So here you have to talk about the tip, straight, curve, various sizes of the needle and the sizes of uninsulated part of the tip. Correct?
Hmm.
Various indications. What are the various indications?
Radio frequency
ablation,
ablation.
sir.
Okay, so radio frequency ablation, and you can talk about the different radio frequency ablations.
Genicular ablation.
Okay,
Trigeminal nerve.
okay,
Median branch RF.
okay,
Facet median branch block.
that is median branch. Okay,
Yes.
SI joint.
SI joint also.
SI joint.
so any of the nerves, any of the joints can be ablated. Yes, there are different methods to ablate that, but you can do that, right? Here, Viva goes on to the, if you talk about, so you should be knowing what tip to be used in which particular block commonly. So it's not a standard, but commonly a few uninsulated tips are used in few different blocks. So MIPSs that you should be aware of. This is below.
Electro.
Electrode probe.
Okay, radio frequency, probe, electrode, the different names. What is the function of this?
The current gets passed through this.
Conversion of thermal energy into the electrical energy into thermal energy.
Conversion of electrical energy into thermal energy. Anybody else?
It also has got thermocouple,
Actually, it
which
senses
So this is
regulates
RF probe or
temperature.
thermocouple. You can call it anything. Go ahead. That is not an. By the way, those are not an absolute correct answer. Okay.
So it actually senses the heat generated at the tip and it records the heat and it transmits back.
Correct. Correct. Go ahead. Go ahead. So thermocouple or RF probe, the one of the most important function is it will transmit the electric current, but it is not the reason to hit or to generate a thermal energy, but it senses the temperature, transmit back to the machine, and then machine adjusts the voltage. Okay. How heat is generated is because it will create a current and there will be a to and fro movements of cations and anions. And there will be a friction, and that friction will generate the heat. The friction will generate the thermal energy. Thermocouple does not generates the temperature or thermal energy, but it senses whatever temperature you set, is it senses the tip temperature and send back signal to the machine, and then machine adjusts its voltage or it changes its temperature. Correct?
Yes.
Fantastic. Okay, what is this? Have you seen this?
Cool. Dara.
Cooled RF.
Okay, whenever in an examination, try and make a habit of talking the full forms of everything. Okay.
Cool radio frequency ablation kit.
Okay, so this is cool radio frequency ablation kit with the generator, right? RF generator, right? What are the indications?
Genicular nerve
Genicular
ablation
nerve radio frequency
for creating larger lesion.
ablation.
Okay, genicular nerve radio frequency ablation for the knee. Okay, fantastic. One second,
Side
Knee,
joint.
shoulder, hip, and
SI
side
joint.
joint.
Okay, shoulder. What shoulder? Shoulder. What? Which branches?
Suprascapular.
Suprascapular
Suprascapular.
nerve.
Lateral pectoral axillary.
Okay. These are the articular branches of the shoulder, hip, and knee.
Mm.
Okay. Though the suprascapular nerve, in suprascapular fossa, you cannot go for the cool radio frequency ablation. So those are the articular branches. Am I clear?
Okay.
Yes, sir.
So articular branches for shoulder, hip, and knee. So what different questions will be? A difference between cool radio frequency, bipolar radio frequency, and the conventional radio frequency ablation. So these three are ablation: cool radio frequency ablation, bipolar radio frequency ablation, conventional radio frequency ablation. Pulse is a radio frequency. We do not ablate the nerve because it is at 42 degree. Right? Here the question will come, how the lesion size is bigger. So what will be the difference between cool radio frequency and the conventional? Anyone?
Charring won't be there in cooled radio frequency ablation, sir.
Okay.
Issue charring. And the gauze is more higher size. The needle size.
Okay.
And what is it? Cooled and conventional, the probe in cooled RF, the probe will be perpendicular. The perpendicular, they should be parallel, sir, in conventional to the nerve.
Why is that?
Because the tip.
So you are not correct. You said cool radio frequency, the probe should be
perpendicular.
That is what you said, right?
Yeah, it's ulta. It's opposite, sir.
Okay, still that is not correct. Anyone else?
So cooled radio frequency will produce a larger spherical lesion, sir.
Okay, correct.
And conventional radio frequency, the lesions will be ellipsoid in shape, sir.
Okay. Cool radio frequency is a directional independent. So the lesion size, see, this is a lesion size of cool radio frequency ablation. Can you see this?
Yes, sir.
Yes, sir.
See, this is a lesion size. So anywhere is the nerve, the nerve comes into the, if it is in the vicinity, even if it is parallel, it is perpendicular, it really doesn't matter. The lesion is bigger, goes beyond the tip and spherical. So cool radio frequency, it is directional independent. Where as a conventional lesion is mostly around the shaft. So your nerve should lie parallel to the tip. Can you see the direction of the thing what I am moving here? Marker? Yeah. So if your needle is parallel to the nerve, it will come into the lesion. If your needle is perpendicular, a conventional radio frequency ablation will of no use. Is that clear?
Yes.
Yes, sir.
Now, one more question. What about the pulse radio frequency? I'll just check if there
It
is
is
any.
perpendicular to the
Yeah.
target.
So pulse radio
Tip.
frequency ablation lesion, the
Needle tip.
temperature is beyond the tip. So there,
Yes, sir.
your needle tip should be perpendicular. Is this clear?
Yes, sir.
Yes.
Yes, sir.
Chalo, somebody repeat. चलो फटाफट.
Sir, in cool radio frequency, the lesion cause is
अपना वीडियो
spherical.
ऑन करो so I'll be know
Sir,
if
there's some
possible.
problem with my
Okay,
video
चलो
today. Sorry,
फैंटास्टिक.
sir.
कौन है? आपका नाम क्या है?
Nidhi, sir.
हाँ चलो निधि, 1 by 1 चलो.
So
First
cool
निधि.
radio, the
1.
cool radio frequency, sir, it is it should be placed. It can be placed perpendicular to the nerve, while the conventional one needs
Wait,
to be
wait, wait.
parallel to the nerve.
Wait. Again wrong.
No, no, no.
Cool radio frequency ablation
It
lesion is
independent upon the. It
it
doesn't
is
depend.
exactly it is directional independent. That means you can
Independent.
put it parallel, you can put it perpendicular. It really doesn't matter. Is this clear?
Yes, sir.
Yes.
Okay. आपका नर्व ओके नर्व यहाँ पे है, यहाँ पे है, यहाँ पे है. इट रियली डजंट मैटर. ओके ओके
Yes, sir.
चलो वापस निधि बोलो.
So the lesion formed by the cool radio frequency is going to be a spherical one,
And
while
it is
in the
bigger as
conventional,
compared to the conventional or
conventional,
pulse. Okay, bigger
yes,
and
sir,
spherical,
bigger and spherical,
goes beyond the
while
tip.
yes, so beyond the tip.
हाँ.
While in the conventional, it is ellipsoid one, and beyond the tip, it won't be that bigger in comparison to the
So
cooled
it
one.
is around the shaft. Okay,
Yes,
can you see
sir.
this?
Yes, sir.
And in pulse, it goes beyond the tip. So which one will be directionally, what directions will be needed if you are doing cool, if you are doing conventional, and if you are doing pulse?
Sir, if it is cooled, then it is, as you said, that it doesn't depend upon the
I
direction.
didn't say it is what the fact is. So it
It
is
is
directionally independent,
it
right?
is directly independent, sir.
Fantastic. What about conventional?
So it should be placed parallel to the nerve.
It should be placed parallel to. Can you see that it has to be placed like this, parallel? And what about pulse?
Perpendicular.
Perpendicular.
Fantastic. Any doubts? Anyone? Any doubt?
Sir,
No.
and sir, in this temperature generation can be generated. We can control in cooled RFA
हाँ हाँ
by
तो उस पे तो आ जाएंगे ना, उस पे तो आ जाएंगे. बोलो. हाँ गुड. फैंटास्टिक. सेकंड पॉइंट, व्हाट इज डिफरेंस? चलो बोलो. टेम्परेचर.
conventional RFA has got temperature limits, and it
टेम्परेचर.
is more. There is a limit for the temperature, and it is more around 70 to 75 degrees Celsius. But here, without increasing the temperature, we can increase the size of the lesion by flow of the water around the cannula.
Can you explain this? You are partially correct. You are काफी हद तक you are correct.
Sir, whenever there is increase in the temperature, there will be
You are
adjustment with
talking
the
about
voltage.
what?
Conventional.
Conventional or okay, conventional.
Yeah, conventional. There will be adjustment with the voltage inside the machine. So the temperature is controlled. It is set according to the whatever we set in the machine. So that temperature is limited.
So in conventional, whatever we set temperature in a machine will be delivered, correct?
Yes, sir.
So how is it related to the size of the lesion?
So initially, when we increase the temperature, in conventional one, what happens is that there is a sharp increase in temperature. Because of that, the charring of the tissue occurs around it, which provides the impedance. That's why the further lesion size will not get increased. While this is not so in case of the cooled RFA, where a water channel is there and that dissipates the heat along with it, and that's why less charring and more bigger size of the lesion is created.
Okay, nearly correct. So what happens is, I will just check whether I had done that or not. Okay, fantastic. Okay, so what happens is, see, this is your thermocouple. Can you see?
Yes, sir.
Fantastic. So the electric current from the machine. So first thing is lesion size is directly related to the voltage. Is at 70 degree, right? What will happen once your temperature starts increasing from 40 to 50 to 60 to 70? Once it reaches 70, thermocouple will sense that the temperature has been reached, correct? Now it
Yes,
will
sir.
send back a signal to the machine. Oh, the temperature is reached. Now don't increase the current or don't increase the voltage. Correct? And machine will
Mm.
stop there. After some time, the temperature will come down to 69 or 68. Again, thermocouple will see a signal. Okay, the temperature
Mm.
started falling, so voltage will increase or it will remain into that. So these machines are now so good that it remains quite constant at the 70. So voltage is not increase, right? One of the factor which decide limit lesion size is voltage. More the voltage, more the lesion. Here voltage cannot be increased beyond a certain temperature because the temperature is sensed and it signals is given back through thermocouple to the machine that now stop or now continue at this temperature. But is this correct? But in cool radio frequency ablation, what happens is temperature is, say you have set it at 60 degree, your temperature start increasing or 70 80 degree, your temperature you have set started increasing from 40 50 60, your temperature is rich. So what happens is water flows through, I will show you, water flows through the channel. This is thermocouple over here. This will sense that the temperature is increase rich, but now still the voltage will be more and that will increase the lesion size, but voltage will not increase further temperature because water will dissipate the heat, as she correctly point out. So water will start flowing out more and more and more. Once the lesion size is achieved, that will be that will be the end point. Here in conventional, what happens once the temperature is reached, voltage does not increases. Here, even if the temperature is increased, voltage increases, but the extra temperature is carried out, extra heat is carried out, carried away or dissipated via the water. And that's why the lesion size is bigger. Is that clear?
Yes, sir.
Fantastic. So there is Teflon coating, water inlet, RF probe, water outlet, water will come through this and will enter through this, right? This is the cool. So comparison between the conventional and cool, you will be all asked. Lesion size. What are the various factors which describes the which decides the lesion size? One, length, tip length, diameter of the needle. So it is said that you take the bigger needle for the lesions where if you are not doing the cool radio frequency,
Mm.
you can choose to have a bigger cannula. Temperature to a certain degree. It's very important. Temperature to a certain degree increases the lesion size. Beyond that, it does not increase the lesion size. Time to a certain time, the temperature, the lesion size increases. Not beyond that. Bipolar causes a bigger lesion size. So this is the difference between the cool radio frequency and the conventional radio frequency. Directional independent spherical. This is along the shaft. Okay, so this is about the pulse radio frequency ablation, where the thermal changes, electrical changes occurs beyond the tip, and that's why in pulse radio frequency tip should be perpendicular, in conventional tip should be parallel, and in cool radio frequency directional independent. Am I clear onto this concept?
Yes.
Yes, sir.
No confusion at all? Fantastic.
Sir, can you please explain about the mechanism of RF in cooled and yes, conventional R,
Okay.
about the voltage?
So see, what happens is here one of the factor which decide the lesion size is the voltage. Now what happens is in conventional, once you reach that particular, how the temperature is controlled. So in short, increase the voltage, lesion size will increase. Is this clear?
Yes.
Fantastic. Now what happens here is in conventional, you reach your desired temperature. So once you reach a desired temperature, desired voltage further cannot be increased. Why cannot be increased? Because thermocouple will send back a signal to the machine that a desired temperature is reached. Is that clear?
Yes,
Yes,
sir.
sir.
So lesion size will be limited to that part. Now here in cool, what happens is you set a desired temperature. Once that temperature is achieved, what happens in conventional? Once that temperature is achieved, the machine thermocouple will send back a signal to the machine not to increase the voltage. But in radio frequency, cool radio frequency, machine will say that, okay, still increase the voltage. Now increasing the voltage ideally should increase the temperature, but that doesn't happen because the water flow dissipates the energy, dissipates the thermal energy, and you go on increasing the voltage. Still temperature remains same, and as we have seen, the increasing voltage increases the lesion size.
Lesion size.
Is that clear?
Yes, sir.
Fantastic.
Thank you, sir.
So difference between continuous radio frequency and pulse radio frequency. Continuous is gives continuous energy for 90 seconds. Pulse, so it gives an energy into pulses 20 milliseconds and washout period of 480 milliseconds. Needle tip here is parallel. In pulse, it's perpendicular. Tissue temperature continuous or the conventional radio frequency up to 80 degree. Pulse radio frequency 42 degrees. Some people or sometime it can be 45 degree. For the exam, you can say 42 degree. Conventional radio frequency, it is a thermal destruction. It's called as radio frequency ablation. You can call it. In pulse, it is neurobiological or electromagnetic changes. Continuous deafferentation is side effect because that's directly related to the temperature. Pulse, no such side effect is observed. But continuous, we get a long duration. Pulse radio frequency sometimes, not sometimes, but the duration is little shorter. We can use pulse radio frequency into the peripheral mononeuropathies. Clear?
Yes, sir.
Fantastic. So Rax catheter. Rax catheter is used for epidural adhesiolysis, especially in the post-spine surgery syndrome. So this is an assembly of the Rax catheter. I will show you, maybe we'll compare the tips of various tips. See, there is a low friction coating and a traumatic smooth distal tip. So you can go into that area, fibrous area. You can change the direction a little bit. And here RX2E needle will be used. So if you have to change the direction, RX2E needle will be used. Special use in post-spine surgery syndrome, especially epidural adhesiolysis for the epidural fibrosis. Right? So Rax catheter. Have you seen the trigeminal balloon decompression kits?
No, sir.
Hello?
No, sir.
No, sir.
No. Okay, no problem. If you are not seen, that is absolutely fine. Nothing to worry about it. So this kit comes with, this is in balloon catheter. You will have few puncture needles, syringes, and connector. So what you do is you put a puncture needle into the foramen oval, then you insert a balloon catheter, put the contrast, inflate the contrast, procedure to be done under the general anesthesia. Advantage or radio frequency ablation, immediate onset of action, no deafferentation, specially done for the V1, general anesthesia is required. Is that clear?
Yes, sir.
Yes, sir.
Okay, so vertebroplasty kit, name itself suggests for the vertebroplasties. Here you will be asked about indications and contraindication. If the posterior cortex is broken, then that becomes an
Contraindication.
contraindications for the vertebroplasties. So you will have introducer, you will have a cement inserter, guide wire or guide pin, dilator and drill bit. Procedure will be asked. Here important is you do not cross the medial border of pedicle till in lateral view you are into the vertebral body. If you didn't understand this, I'll repeat it. Do not cross the medial border of pedicle until your needle tip is crossing the posterior border of vertebral body. Will be asked the indications, contraindications, and one more kit will be there, vertebroplasty plus kyphoplasty. In kyphoplasty, nearly the same, but there will be a balloon inside. You can inflate the balloon, make a space, and then put the cement. So difference between the kyphoplasty and vertebroplasty will be asked to you. So here will be a kyphoplasty balloon, a manometer, have you seen the intrathecal pumps?
No. No, sir.
Okay, fantastic. So this device, you will be having two devices looking nearly, not nearly the same, a little different. Just have a look onto this. I will explain this. Okay, fantastic. See, these are the two devices. One is intrathecal pump. Lot of differences are there, but I'll show it. Primarily, it looks like the same intrathecal pump and spinal cord stimulator. We'll see the difference. So this is an intrathecal pump. So the question will be FDA approved drugs for the intrathecal pumps, right? So there are three drugs. Should be aware of it.
Baclofen.
Morphine, baclofen, then
Morphine.
ziconotide.
Correct. So in intrathecal pump, there will be filling port, there will be reservoir, there will be catheter access port and catheter port. Okay. So this will be a filling port where you have to insert the drug and you inject the drug. While in spinal cord stimulator, you will not see such assembly. Can you see the difference between two?
Yes, sir.
So here
There
will
is
be
no
a
filling
port,
port in the
reservoir,
costume.
catheter port, and there will be a catheter. Here it will be a generator, implantable pulse generator. In examination, sometimes you get confused just because of stress. So if you see some battery-like thing, it is implantable pulse generator for the spinal cord stimulator. Various leads, remote control, and batteries will not be kept to you. Only these two things mostly will be kept for you. Okay. Various indications, contraindications, side effects. There's possibility that you might not have seen this. Okay. There will be a disc pressure monitor for the discography. Will look like this. You should know what is a provocative discography, what are the different pressures and methods. Okay.
Okay, sir.
So, any doubts? Things are very simple. Keep it simple. Every day, whatever you are using regularly, please make a point that you go through it properly.
Sir, can you please repeat the first instrument, sir?
Yeah. So, how to describe the instrument? Identify it. Describe various components from the proximal to distal end, or vice versa, or patient end to machine end. Specifications, various sizes, capacities, mechanism of action of the particular instrument if applicable. Sterilization, most of the things will be pre-sterilized, few will be. So pre-sterilized with what? There is written it is written on every instrument. If it is reusable, please make sure you know how to sterile it. What are the advantages, disadvantages? What are the indications, contraindications? Any specific precautions, special notes, and comparison. What not to do is, if common instrument identification is must, you must know each and everything about the common instruments. If you don't know, but like if you want to use spinal cord simulator, you just can tell I have not used it, I have not seen it, or I have just seen the generator, and go on talking about various things. Mistakes will not is not a reason to make you fail, but yes, don't make the blunders. Make a mistake, but don't make the blunders. Chalo. Any questions? Mostly this will be instruments. If any other instrument, you can go through the list of our instruments and you can just read it. A difference between the Rex catheter or the RX2 in ELL, normal epidural, that will be asked to you. Not very difficult. Fantastic. I hope you understood that.
So,
So if
so
there are no any
can you please put up the slide of the first instrument, sir? I